video is going to talk about what a psychiatric nurse does on an inpatient acute psychiatric unit. I think that a lot of nursing students specifically, or even people in general, have no idea what a psychiatric nurse does. I think people think of nursing and they think of medical nursing or ICU or 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 maternity, but what do psych nurses do, right? This is the question that we're going to answer in this video. All right, so let's first paint an outline of what an acute inpatient psychiatric unit is so we can better understand, because unless we have been a patient or a family member in an acute psychiatric inpatient unit, we have no idea. It is a mixture of patients who have voluntarily admitted. So those are the patients who, for whatever reason, are going through a crisis or came to the emergency room or went to their outside provider and the provider said, I think you should go inpatient for psychiatric treatment. And they say, okay, I agree, on an involuntary status. And this in Massachusetts would be called a Section 12, but in other states it's called other things. And this is pretty much a provider has said, you are a danger to yourself or others. We're going to hold you against your will. So that is why it is locked, because these patients cannot leave because they are a danger to themselves or others. Some people may think that this sounds scary, but it isn't. It's just typically these types of patients have a change in mental status that is making them not be able to perceive the outside world correctly. These would be things like psychosis or severe manias. There is also, people who might have personality disorders. I don't really like that name because I feel like it does have some stigmas attached to it, but these patients may see the world differently than we do. So certain things that may make them upset or whatever may lead to them feeling suicidal. So patients maybe have something like a major depression or a bipolar where they're in a depressive episode and they are feeling suicidal, and so that's what kind of makes them a danger to themselves. These are people that need medication management or medication adjustments. So we hold them against their will because we're trying to help them get out of that state, but when they're in that state, they can't adequately make decisions appropriately. Once they get stable on their meds or other treatments like TMS or ECT, they can then think appropriately, and that's when they would be discharged. So, okay, I'm going on a tangent. Okay, so inpatient acute psychiatric setting. So it is a locked unit. This doesn't necessarily mean that they're criminals or they want to kill people or anything like that. I know people get scared when they hear inpatient locked psychiatric unit because they think of the movies, right? It's like a jail, it's locked. It's not like that. These places, these units are, especially nowadays, like it's not the 1960s or 1940s anymore, they are created to provide a therapeutic place for people to heal and get medication management. And I think the biggest thing with an acute inpatient locked unit is access to providers and medical care. We live in a society where, dependent on insurance or appointments, it is very difficult to find a psychiatrist or psychiatric nurse practitioner and get an appointment quickly. I mean, these appointments will say, oh, in 2 weeks, oh, in a month. I mean, some places where they are rural, some places it's months and months wait. Access for care for these patients is very difficult and that's why I think a lot of patients don't get care, and then they have an acute crisis, and then they end up on a psychiatric inpatient locked unit. However, it's wonderful in the fact that we have social workers, we have nurses, the nurses are with them 24/7, and we have providers, and they start seeing a provider right when they're admitted. So you're getting the medication management, you're getting the social worker who's doing the outpatient, setting up appointments and things. I mean, when you're talking someone who may have a severe mental illness, them being home and making appointments with therapists, psychiatrists, even just PCP can be super difficult. So it's really great we have those resources for these patients. Also, therapy groups, that's something else that goes on. So that's kind of painting the picture of what an inpatient psychiatric unit is. So what is the role of the nurse? So a nurse, and I think in all settings, and when we talk about like nursing theory, a lot of nursing theorists talk about this, the nurse is like a caretaker, right? And that's in all settings of nursing. And it's really important to be able to understand the patient and understand, what makes them upset, what helps them, because we need to use those as tools in our toolbox to be able to provide care and help them through whatever emotion they're currently feeling. So the first thing, when the patient arrives to the floor, the nurse is responsible for doing an admission assessment. This is very similar to an admission assessment on any other unit. We're assessing previous medical treatments, previous psychiatric treatments, any medications the patient is on, objective and subjective data, things that we see, any rashes, any cuts, anything like that. We're also looking at the mental status of the patient, how they present. Once the patient is on the floor, the nurse works with the psychiatrists and the social workers that we have on the floor in providing care for the patient. We give them their medications, which are prescribed by the doctor, but what our role is that is super important is because we're with the patient 24/7, we are constantly assessing their needs, we're assessing their mental status, how the medication is affecting them. We need to look out for side effects of the medication, any, sedation, any need for more medication, if they're agitated or anxious. So we're really advocating for the patient using our objective data, like what we see, what we assess to identify their needs, because a lot of times on an inpatient psych unit, these patients can't identify their needs. Like they may be like, they may just present anxious. They might not be able to communicate, I'm anxious, because in their mind, they're seeing things that aren't there, they're hearing things that aren't there. Their mental status is completely different than what we are experiencing as the nurse. So we need to be able to identify that, be able to identify, oh, there's an escalation of behavior, or something seems to be wrong, they're upset, so we are constantly monitoring. And just like any other field of nursing, they always say assess, 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 and that is what we're doing. We're assessing, we're providing interventions, we're coming up with plans, we're diagnosing, the same nursing care plan of any other part of nursing. However, it depends on what unit you work on. On my unit, we actually do have medical issues that come along. I know some units will be like, don't do IVs, or don't do wound care, don't do, like, there's certain medical things they don't do, but our unit, we cath, we give IVs, we do wound dressing changes. So, that field of nursing still comes over into psychiatry. So I think a lot of people get confused in what psych nurses do, and we're multifaceted. We're doing the medical stuff, but we're also doing the psychiatric stuff. And I think that medical nurses do that too. It's just reverse. Like they see it as like we're doing the medical stuff, but they're not. They're also caring for the well-being of the patient. They're really creating that therapeutic alliance with the patient to provide care, because we need to create that relationship with the patient to be able to have them be open to education and open to our suggestions. It's very traumatic in any field of nursing to tell a patient, you need to take these meds. Nobody likes to take meds. It's scary. Like, what are the side effects? Like, do I have to be on these forever? Like, it's a lot. People might be more open if you're like, oh, you're going to just take these meds for a week and your problem's going to be gone. Then people are like, yes, give me the meds. But oftentimes in psychiatry, it's like, you're going to take these meds forever. And that's tough. There's other illnesses like that, like autoimmune issues, or like maybe seizure disorders. Like there's other disorders that kind of fall into that category of lifelong medication management. Diabetes is a perfect example. And, these patients don't always follow it, and they're in and out of the hospital. And so psych is very similar to medicine in ways. or like regular medical surgical nursing. In ways it's slightly different, but the role of the nurse, and I think in any setting, is to be assessing the needs of the patient, creating a diagnosis of what their needs are, like according to their needs, like planning interventions and evaluating those outcomes. So right back to the nursing plan of care. But other things that nurses do in the psych unit is we also discharge patients, just like in regular medical units. So when a patient is discharged, we get together their belongings, we go over their after visit summary, we discuss their appointments and medications post-discharge, and we give them resources that they can contact if they're in need of talking to somebody. So just like any other part of nursing. There's a lot of coordinating care. I think that nursing in general is coordinating care. So we do a lot of that as well, working with speech and language, like occupational therapy, physical therapy, medical service. We're coordinating their CAT scans, their x-rays. I mean, typically a good amount of psychiatric patients haven't been attending to their regular medical needs. So my facility, they're very lucky that we have a medical service that is just for psych. So when they come into us, they not only are getting psychiatric services, but they're also getting the medical services that maybe they haven't been provided outpatient. So people might come in with a shoulder injury that they got a year ago, but never went to the doctor, never got it assessed. So we're doing all of those types of medical things as well. So that's really exciting too. I think a big issue that I see often with psychiatric patients is like issues with bowel movements, and that's because their medications typically do constipate them, and then you have to assess for like blockages and things like that. So my favorite thing about psychiatric nursing and why I love it so much is that you really are creating a relationship with this patient based on trust. A lot of times they're very scared for whatever reason, the situation that they're in, the mental status that they're in, and it just is very rewarding when a patient accepts your education and your recommendations because they trust you. And that therapeutic alliance is really what inspires me and motivates me in being a psychiatric nurse. And I hope that all of you out there that are watching this and want to be psychiatric nurses or are just curious, I hope that you get to experience that, because I think you'll really love this specialty of nursing. So, all right, if you like this video, give it a thumbs up and make sure to subscribe below. I'll have new videos every week. Thank you for tuning in. Bye.